This is a visualization of chronic ischemia. While these constricted vessels starve tissue of oxygen, the introduction of a specific pressure wave triggers a transition to a dilated, healthy state. Standard management for this condition typically relies on pharmacological agents. However, these chemical interventions often face efficacy ceilings, where the benefits plateau even as the risks of tolerance and dependency increase. These clinical limitations have led to the adoption of functional interventions that prioritize biophysical repair over chemical suppression. Vibroacoustic therapy, or VAT, fits this model by using specific mechanical frequencies to target tissue recovery. Formulated by Norwegian researcher Olav Skille, the original VAT methodology applies pure, low-frequency sound pressure waves calibrated between 30 and 120 Hz directly to the body. The waveform itself is the defining factor. Jagged, high-amplitude sawtooth waves create aggressive mechanical friction that can tear fragile tissue. The Skille method uses perfectly symmetrical sinusoidal waves to deliver energy through resonance rather than impact. This approach does not use chemistry to mask sensations. It translates mechanical sound waves into targeted cellular reactions designed to accelerate the body's natural regenerative cycle. The efficacy of these waves is a result of the environment they travel through. The human body is approximately 70% water. While sound moves through the air at 343 meters per second, it travels nearly 5 times faster through fluid biological tissue, reaching speeds of 1,500 meters per second. At 40 Hz, sound traveling through an aqueous medium generates a footprint 37.5 meters long. Because this wavelength is exponentially larger than the human body, the pressure wave glides through the biological boundary without breaking at the skin. This creates an inside-out cellular massage. The sound reaches deep internal organs, vascular networks, and nervous systems that are entirely inaccessible to manual physical manipulation. Because these waves do not break at the surface, they deliver non-destructive mechanical displacement directly to ischemic cellular structures. Clinical benchmarks for tissue repair define a specific window of efficacy, a 47 Hz frequency delivered at an ultra-low amplitude of 0.18 Gs. At the capillary wall, low-amplitude vibration generates fluid shear stress. This mechanical friction triggers endothelial nitric oxide synthase. The resulting nitric oxide forces the vascular smooth muscle to relax. The microcapillary dilate, flooding the hypoxic wound bed with oxygenated red blood cells. This NO-induced vasodilation restores microcirculation, reversing the vascular starvation that prevents chronic wounds from healing. Simultaneously, the mechanical wave forces a change in the immune response by downregulating pro-inflammatory cytokines like interleukin-6 and tumor necrosis factor alpha. Driven by the mechanical signal, this macrophage shifts from an aggressive, inflamed M1 phenotype to a pro-healing M2 phenotype. This cascade stimulates the release of growth factors like VEG, which initiates angiogenesis, the sprouting of new capillary loops necessary to close diabetic foot ulcers. By using mechanical friction to trigger biochemical repair, that resolves the ischemia that traps chronic wounds in a non-healing state. The same mechanical waves target the nervous system through Pacinian corpuscles, mechanoreceptors in the skin and connective tissue, highly sensitive to low-frequency vibrations.
This is the gate control theory in action. Frequencies between 60 and 120 Hz stimulate fast-conducting A-beta sensory fibers. These signals travel to the spinal cord much faster than pain signals. Because A-beta signals reach the dorsal horn first, they close the neural gate, blocking slower C fibers from carrying chronic pain signals to the brain. Beyond blocking pain at the spinal gate, low-frequency resonance directly stimulates the vagus nerve. This causes a parasympathetic reset, reducing systemic cortisol and increasing heart rate variability. VAT acts as a dual neurological intervention, simultaneously blocking the perception of localized pain while shifting the entire organism into an anabolic healing state. One specific frequency has become a primary focus of modern neurological research: 40 Hz. When applied to the human body, 40 Hz sound vibrations interact with the brain's natural rhythms to induce gamma wave entrainment. Emerging evidence from MIT shows that 40 Hz sensory stimulation can reduce the accumulation of amyloid and tau protein burdens in the brain. This protein clearance is linked to protecting hippocampal volume and preventing neuron death in patients with early-stage cognitive impairment.
This precise application of 40 Hz sound waves provides structural neuroprotection, actively reinforcing cognitive resilience against cellular degradation. Like any biophysical intervention, the physiological cascades triggered by these waves require consistent application to maintain their effects. To sustain the parasympathetic shift between clinical visits, the original scale protocol advocates for 15 to 23-minute sessions administered daily. This table shows why specific calibration is necessary. Each frequency zone within the 30 to 120 Hz range maps to a different biological target, from muscle spasm reduction at the lower end to circulatory support in the mid-range. Achieving this daily clinical dosing requires embedding high-fidelity transducers directly into the patient's home environment. Making that accessible via home bedding is not a convenience, it is a clinical requirement for sustaining the physiological momentum necessary for chronic recovery. The TheSoundWell kit is a modular implementation of Skilly's research, using a calibrating app to deliver 7 distinct harmonic frequencies to the body. The Sound Bath Topper provides whole-body contact, utilizing delta range waves to encourage deep sleep architecture and restorative brainwaves. This medical illustration shows the precision of the sonic cuddly pillow. The transducers are positioned to align with the skull and cervical spine, maximizing resonance along the cranial nerves and the upper vagus nerve. The soft snuggling blanket adds a dual mechanism layer, pairing the serotonin-releasing benefits of deep pressure stimulation with upper body mechanical vibration. For site-specific issues, the sonic harmonic sleeve targets peripheral capillary beds and localized inflammation, such as the pain associated with fibromyalgia. These components work together to create a sonic ergonomic environment during the body's most critical regenerative phase, sleep. By utilizing the fundamental physics of sound to trigger biochemical change, vibroacoustic therapy provides a sustainable, data-driven path to healing that operates entirely through the body's natural mechanics.